Well, hello there, ladies. This is Dr. Up and Adam with a little statistical digest coupled with musings of my own concerning the various methods of healthcare screening concerning you good ladies out there. I'm talking about gynae matters here, those affecting the boobies and the doobies. Okay. So American folk have realized something's going on here when it comes to gyno doctors. That is someone who has spent over 6 years learning about and become an expert in female body parts. I know men take a great interest in this area, but few of us spend over 6 years studying them and working with them. I'm just saying. In fact, in the USA only a fifth of obstetric and gynae specialists are men, but in the UK those figures are quite a bit higher. You check the figures. So in the USA people are more concerned about medicine, because they use practices that cause patients a lot of concern, like putting your hand in your pocket and paying either directly or with your insurance for your care. Either directly or via insurance in America, but in Britain it's free. So, women in the US realize that standard annual examinations of their midriff by a doctor doesn't really produce evidence-based results in terms of diagnosing a whole heap of conditions. They reckon going on spec is unlikely to produce any result compared with self-referring a concern. But you know, the cervical testing that we do in the UK and they do, usually by a nurse, that produces much better results. You can check the statistics yourself. But roughly out of the group invited to be tested, 78% attended. Out of those, about 1 in 20 need follow-up care. That's considered worthwhile. What the Yanks are considering not worthwhile is showing up yearly to a doctor perform internal examinations with their fingers for no reason. This don't produce results. Also, they realize some women have been held to ransom and haven't been able to get a prescription for the pill, or have been scared away, because they're told they need this type of examination. So, ladies, here are the facts as I see them. Screening for cervical cancer is a good thing. If you're invited, go, ask to see a female nurse. That's your right, and if absolutely is your right, don't be lied to on this. If you're starting on birth control, you don't need an examination unless it's a cap or a coil. For the pill, it's not needed, but it's worth having a cervical check down the line as your risk can increase. Annual examinations for women who have no problems, well, they simply aren't needed, unless you feel you have a problem. Please research this yourself, but check out America's change in view of this type of health concern. Thank you for listening. In summary, don't be scared to go if you have a problem that's female related. It's your right to see a woman, and if you don't have a problem, no one can bully you into an examination. Cervical screening is effective. Other methods ask for proof and statistics.